So I would like to thank AIOS and Dr. Zain for giving me this opportunity. So I'll be talking about marketing your refractive surgery practice as a newbie in the field. Okay. Basically, what happens, you have just finished your fellowship and your training and you have decided to start your own practice as a refractive surgery consultant in the city. What are the things you can do to successfully establish a surgery practice amongst the already established practices that you have around you over the years and have been attracting patients? Outline for the talk is basically we will discuss about how having your own setup, getting attachments is helpful. Generating an initial patient database is very important. Then there's a strategy to follow about after you get your patient database. Then are a few tips and tricks for marketing yourself, your practice, targeting the right population, which a lot of people miss out on. And of course, as my previous colleagues have mentioned, updating yourself with the latest technology is very important. Basically, post-training, I would suggest that, initially you can just join an established practice in the and learn how private practice works before venturing out. It teaches you a lot of things about the non-surgical part where, how to manage counseling, convert your patients, retain them, retargeting them, remarketing to these patients and their family members. Because when it comes to refractive surgery, there's no concept of visiting doctors. You will hardly see refractive surgeons as visiting consultants because most of them have their own centers and they do it on their own and they don't require other doctors to come. There's a concept of visiting patients. So the center, because the cost of putting your own infrastructure is very high. Initially, the most important thing is creating your own patient database. Once you start the other things flow. Sometimes it has to be at the cost of, increasing revenue, having to give out discounts or having introductory offers. Having a healthy patient base ensures organic growth, which is actually the most important thing. Like for example, today's refractive error patient, someone who walks in at 16, 17 years of age, will be a few years down the line your own LASIK patient. So treat them well. Cataract patients, they get you everything. They'll get you sweets, they'll give you blessings and goodies, and sometimes they even get you refractive surgery patients. Even your pediatric population who are, initially very shy and coy, but over the years, since they have interacted with you, they have a trust in you. When the time comes for them to take up a surgery, they will not look anywhere else. There is something called as a 3M strategy where, you master your skills, then you market them, and then there is a management of the patient. So these are not independent strategies. They all co-dependent on each other's. Mastering your skills is most importantly, you better be a good surgeon. There is no second opinion about that. You must know the latest technologies and used and the treatments offered. And you should have the experience to do it well independently and managing complications. Do all your training and then take them to the next level of market. There's no point, having a Ferrari or a better car and then not knowing how to drive it. There is something called as management of the patient, not clinical management, but the management of the patient in your clinic itself. What happens is it helps you convince them to go ahead with the treatment you have offered or explain to them. Your staff training, behavior, counseling of the patient, the general experience in your clinic is what helps you achieve that goal. Remember, marketing can just help you get sufficient patients in the waiting room, but managing that patient and his experience will get him under your knife or the laser. So a few important things are like, just invest in a topographer, patient education material when they visit your clinic so that they are informed about the procedure. Not everyone knows what a contour is. Everyone knows what LASIK is probably, but they may not know what a smile or a contour is. So it's your duty to, inform them at least so that they will have an informed choice. Then your counseling, either you do it or you have a counselor at some stage in your practice and it helps. Then comes to the marketing aspect of your practice. Marketing gets you sufficient footfalls in your waiting room. So nowadays it's very easy. You can do it from the comfort of your clinic or your home. It doesn't require you to spend a lot of money if you do it very smartly. So a few weapons for marketing are, we can talk about them as activities, personal branding, your videos, social media marketing, which plays a very key role, friends and family schemes, and there is a referral system with other doctors, which we will touch upon. So initially, as a new refractive surgeon competing with the established practices, you can start off with camps and general screening camps. And nowadays you have refractive surgery screening camps. best target population I feel is, corporates and banks and IT offices and college students, because these are the age group who are most likely to consider refractive surgery as an option. There are some, I even know someone who has tied up with community matchmakers to refer potential brides and grooms for their classes. It's just weird. Some networking platforms like BNI and influencers on Instagram and Facebook, you can just do live and, get your presence noted. That comes under personal branding also, where you can, just join community events, camps, your doctors federation meets, like how we have informed the MIRSA, where, we help each other independently when someone requires a scan, the closest scan center or laser surgery platform required, and other things. So there are a lot of things you can do, and you can make your presence felt at conferences by giving talks and lectures in your local IMA and all those things. There are people who can dance at weddings. You can just at least talk about how trained you are and what services you offer. Of course, if you can try getting on the Kapil Sharma show too. Coming to videos. So videos this is a part of social publishing instead of social marketing. What happens is, making good patient education videos, they help build trust in the doctor. They validate his or her views. They alleviate the patient's doubt and fears towards surgery. Before and after videos, patient reviews, experience, treatment modalities. For example, I give you this example of a doctor from Mumbai. This doctor has a subscriber base of 2 lakh subscribers. His reach is almost, you can see, he's got 1 crore views on his thing. He's given an example in a lot of marketing talks and how he's purely marketed his practice based on YouTube, which actually does not require a lot of money to be spent. He now gets patients all over the world just because of his videos. The people get referred just because of his videos. Coming to the big thing nowadays is the social media marketing. What platform to choose, which social channels are best, what should you post, how much time do you invest, all very relative things. So what happens is, why should you include it? Because it helps you build influence in a key area topic, attract newer patients, connect with your peers and patients, and it also drives signal to your website and your social media platforms with the help of SEOs and signals. What channels are the best? Like Facebook, Instagram, Google, My Business, YouTube, a lot of things. So everything has a different set. Some help you generate new patients, some help you build influence, some generate more and more traffic towards your practice. To start with, I think Google My Business is a very important platform where at least it is simplest, informative, and a few more things you can do with paid promotions and, having reviews. Because there are a lot of patients who will search for the location and then they'll come and visit you, and they'll also read about some reviews. So reviews, are you getting the reviews on Google? It helps building trust, a lot of impression about the doctor. Even your negative reviews and how you have handled them and replied to them also makes a lot of difference. There's no point just neglect the negative reviews. It improves your search results. You can post introductory offers and new treatments if you have. Coming to Facebook and Instagram, now the sky is the limit. You post content, you create shareable content. There are more and more likes and shares, and you connect with a lot of people. Just a minute. Coming to Instagram, you can publish, know your audience, pay attention to insights. You'll know what kind of people are looking at your pages. Use hashtags. You never know what gets viral nowadays. There is, invest time in stories and reels and videos, because these are the things that push your algorithm. Something like a friends and family scheme, apart from social media marketing. So basically, my first few patients of LASIK were their grandkids who had accompanied them during the cataract surgery and subsequent follow-ups. Give them example how they can see also better and clear without glasses and undergo the procedure for their spectacle independence. Ask your patients to refer you patients, or they usually do it on your own, and give them referral benefits. It could be discounts, example, for their own surgeries. Works well since everyone benefits, the doctor, the patient, and the referred patient. So there were patients whose grandkids got operated, and then subsequently they got their girlfriends and cousins got operated with me. The referral thing is with your doctors of the other specialties and your ophthalmologists from other subspecialties, where, a retina colleague sends you across a refractive surgery patient and you send him your retina practice. retina patient for a surgery or something which you need. There are things like general practitioners. You can approach them, talk them, even explain to them about the latest treatments like, Contura or something, which they may also not be aware. So that at least they can inform the patients and then they can do it in their way. Other thing is, I will say that it's important to perform at neutral centers just to avoid the clash with the established practice. Feels the patient is under your own control. Investing in a topographer, I think, is an important aspect because that is where you can hold the patient, explain, and take an immediate decision and counseling. Print advertisements, pamphlet newsletters help to an extent. I think marketing is important. Just the last couple of slides. Most important is not to forget to target the right population. Three types of patients: some who are aware of Smile, Contura, and latest technology. They are least likely to come to you. They will go to the established searches on the Google. There's someone who just want to get rid of their glasses. So you can just explain to them and they will be very happy to listen to you. There are people who have no idea about something called basic surgery or PRK surgery for their high error, and they live with it for the rest of their lives. You can just target them. And lastly, you have to keep updating yourself with the latest technology like Smile and Contura or any other Streamlight and No Touch and Bladeless and all those things, because those are the ones that will drive the patients to your clinic and eventually give you outcomes that will matter the most.